Hello, I'm Dr. Rachel Levine, Secretary of Health for the Commonwealth of Pennsylvania. Thank you for inviting me. The COVID-19 pandemic continues to impact Pennsylvanians, with our case counts increasing each day. Of course, that's why I'm wearing a mask, because we have a universal mask mandate. We are working tirelessly to slow the spread of this virus across our state. However, it is vitally important that we do not lose sight of the fact that the opioid epidemic is continuing to rage on in our communities, our state, and in our nation. The overdose crisis is an epidemic within the global pandemic, and COVID-19 has further exacerbated substance use disorders for many people. In 2019, close to 4,444 Pennsylvanians lost their lives due to a drug overdose. This means that on average, nearly 12 Pennsylvanians died from a drug overdose each day in 2019. These people had a family, friends, a job, a life, and we cannot forget a single one. These are members of our community, vibrant people with so much to offer, but their lives were taken too soon. Pennsylvania has seen a 19% decrease in overdose deaths over the 2-year period since Governor Tom Wolf enacted the disaster declaration and subsequently created our opioid command center. However, 2020 has seen an increase in overdose deaths. This year, the Opioid Command Center released our 2020 to 2023 strategic plan, highlighting new efforts in the spaces of prevention, rescue, treatment, and recovery. The department also provided a pathway for enhanced stakeholder and community engagement. As we approach year 3, operating under our opioid disaster declaration, our collective efforts to save lives and promote treatment have grown. We have waived the fees for more than 5,400 birth certificates, removing one more financial hurdle to be able to enter treatment. We have fielded more than 43,000 calls to the Get Help Now hotline, with over 23,000 of those calls resulting in an intake to treatment. EMS across the state have administered more than 46,500 doses of naloxone. And we have expanded access to treatment, particularly medication for opioid use disorder, with our Centers of Excellence and a program called PACMAT, or Pennsylvania Coordinated Medication-Assisted Treatment. We have provided expertise to other states looking to compose a similar opioid command center structure and actively been trying to establish syringe service programs statewide through legislative action in Pennsylvania. The opioid epidemic is not lost within the global pandemic. We are still pushing forward with providing no-cost naloxone to first responders, still having meetings on a weekly basis to identify and quickly resolve barriers, and we are closely monitoring our data trends so we can quickly take action to address immediate needs and concerns, of course with the ultimate goal of saving lives. Our Health Equity Task Force has dedicated a group of subject matter experts to identify needs and barriers for people with substance use disorder amidst the pandemic. And just this year, I amended our standing order for naloxone to allow for mail-based and community-based naloxone distribution for easier access without having to physically interact with others during the pandemic. I cannot emphasize enough that those struggling are affected by a disease, the disease of addiction. We have come very far in reducing the stigma surrounding overdoses and those with the disease of addiction, but we also still have far to go. We know that this can be a difficult time for those struggling with this disease. However, this is the time to enhance our prevention and rescue strategies and to make sure that this trend does not continue. We need family members, friends, and loved ones to reach out to those that they know are struggling with the disease of addiction. We need to recognize what situations may cause someone to relapse in their road to recovery and help them avoid those situations. We need citizens, friends, and family members of people with the disease of addiction to carry naloxone. Together, we can all help each other. We know that addressing the opioid crisis is a marathon, not a sprint. And we are committed to finishing this marathon and committed to helping Pennsylvanians. Treatment works and recovery is possible. We must provide hope to those struggling with the disease of addiction, their families, our communities, states, and our nation. Thank you.